also trying to answer.
Yes,
I will switch to my laptop.
okay, we are live now. Hello, listeners. Good afternoon,
Hello.
and
Good
welcome
afternoon,
us.
Dr.
And
Zaid.
welcome us. Yes, welcome, Prof. Good evening and good afternoon. And we apologize first for the delay. We had some technical issues we fixed, but now everything is resolved. So we apologize for the
Yeah.
delay, and I would like to welcome our guest for today, which is the chat or talk with the Professor Babagoni Waru, who is the Chief Medical Director of the Yobe State University Teaching Hospital, and one among the renowned clinical researchers we have in the country that focus in areas of dementia and specifically of his area of expertise, which is infectious diseases. He's been doing some amazing and awesome work on malaria projects as well as cholera, and we can't wait to hear much about his work and the way forward through the clinical research in Nigeria. Professor Waru, welcome to the studio today.
Thank you very much, Dr. Zaid, for having me on this podcast. Thank you.
Thank you. So it's gonna be casual. I will be asking some questions, and sometimes we just have to go and have a chat so that our listeners can really enjoy the discussion. It's not merely scientific, so it's going to be the language will be plain so people to enjoy. So Prof Goni, could you begin by sharing us your journey in medicine? Like what is the really inspiring, the motivation, the driving force that led you to specialize in infectious disease and tropical medicine?
Dr. Zaid, thank you very much for this very important question. As you have said, infectious disease. The reason why I chose to come into infectious disease simply is because of the fact that it ruled the waves as far as you know medical conditions or health challenges here, especially in sub-Saharan Africa is concerned. One of our major problems we are still battling with infectious diseases. If you look at by WHO, this thing, malaria, for example, before it used to be about 2 million children die annually of malaria. And again, about one third of the population of humankind is also at risk of developing malaria. But with interventions now, these things have been reduced to, let's say, about 600 children now still die of malaria, and most of them are in sub-Saharan Africa. HIV/AIDS, if you look at the epicenter, it's still sub-Saharan Africa. Tuberculosis, globally, you have about 2 billion people who are at risk of developing tuberculosis, and most of them are in sub-Saharan Africa. And then, coning it down to Nigeria, if you look at it year in, year out, we have outbreaks of infectious disease like Lassa fever, in which a lot of people are affected, particularly, in the early part of the dry season. You also have conditions, especially here in Yobe State, like cerebrospinal meningitis. We have outbreaks recently last year, and even this year, we've started having epidemic of meningococcal meningitis or cerebrospinal meningitis in the states. Cholera outbreak also during the rainy season. We have a lot of, because of poor sanitary conditions, lack of access to clean drinking water, and so on, are one of the drivers. So if you look at it, infectious disease rules the wave. It's the most commonest cause of morbidity and mortality, particularly in among the under 5 children and even in the general population compared to non-communicable diseases such as hypertension, diabetes, cancers, and so on, which we commonly see in developed parts of the world. So these are some of the reasons why I became motivated to specialize in infectious disease because I thought I could contribute my quota, in curtailing some of these problems in my community.
Exactly, thank you. And that's really interesting and very robust number of figures, which can be scary, I think, because like hearing the number of people dying because of these diseases, it's kind of it's something that it's been there, but we are supposed to do more. And looking into your bio, Prof, you have had your part of education in Nigeria and also in the UK, and definitely you have seen like the approach when it comes to medicine, clinical research, preclinical research, and how all those things kind of come together in solving the problems we are having. So, how did these experiences all come together to shape your approach when it comes to clinical practice and especially research?
Well, as you have rightly said, I've had my initial training here in Nigeria. After qualifying with MBBS and youth service and stuff like that, I went back for a specialty training, what we call residency training program here in Nigeria. Um, so I trained in the West African College of Physician as well as the National Postgraduate Medical College of Nigeria, where I qualified as a consultant in infectious diseases. And then subsequently, I went to the United Kingdom, uh, especially at the London School of Hygiene and Tropical Medicine, where I had my master's in tropical medicine and international health, as well as also the diploma in tropical uh, medicine and hygiene of the Royal College of Physicians of London. So I've had some parts of my training in the United Kingdom. Notably, I got to understand most of the tropical diseases and infectious diseases better, ironically, in the United Kingdom than
Ironica.
here
I
in
like the word
sub-Saharan
ironically.
Africa, because actually this is where the real stuff is. But when it comes to research and especially had studying it, they are more dedicated than us, so to speak. And if you can see some of the schools for tropical medicine, like the Liverpool School and the London School, have been there for more than 120 years. And they've done a lot of work and a lot of discoveries. Malaria itself was discovered by Ronald Rose, around 1902, which led to his Nobel Prize. And he was one of the alumnus of the London School of Hygiene and Tropical Medicine. If you look at the work of Patrick Manson, and people like that, even the epidemiology, the work by John Snow, especially in 1853 in the cholera outbreak of London and stuff like that. So most of these things, even before the germ theory of disease came into being in the late 19th century, around 1884, before Robert Koch discovered some of the germs, a lot of work was done in the United Kingdom as far as epidemiology of infectious disease is concerned, and subsequently also discovery of most of the infectious pathogens. So I've learned a lot there, especially in terms of research work from people who have been at the international scene, at WHO and so on, who have worked and who have worked even in discovering infections. So that has really changed my perspective. In the approach to research in medicine.
Okay, yeah, thank you. Thank you for that really enlightening question. To follow up on that, I know because recently there have been differences when it comes to, and we can all agree, Prof, that although tropical diseases is for the tropics, and what we have listed here is localized in the sub-Saharan Africa, but we all know that we don't have much of research output regarding those illnesses from the sub-Saharan Africa. Does that mean that all what we are having now is based on the research that is done probably in the UK or in the Europe or something like that?
Well, there are equally there are a lot of research work going on here in sub-Saharan Africa, but the problem is funding, and then even mentoring and training of researchers is very low, compared to what we see in developed countries, particularly in the United Kingdom. Apart from countries like South Africa, most of the countries in sub-Saharan Africa, we have poor funding for research in almost all areas, not only in infectious disease or in medicine, but also even in other areas of science and humanities, we have, there is no much uh, funding for research. At the same time, you don't have also link between the industry, what we call R&D, research and development, linking between the industry as well as the research institution or the universities, because this is where most of the innovations have been done. So this has really affected research in most of these countries. And then if you look at places like the United Kingdom, people are being trained on research right, at the early stage in their career. You are exposed to research, and then you are all the nuances and what have you, so that you develop that independent critical thinking that will now make you an independent researcher, which is what we don't find here. And again, from the lessons we have learned from COVID-19, we need to actually develop, and then direct our own research according to our own challenges. Like I've said, that, for example, in the areas of vaccine development now, we have Lassa fever is a very common problem here in Nigeria as well as in West African sub-region, because Lassa fever, that is one of the viral hemorrhagic fevers. Mortality could be as high as 50%, and then most healthcare workers become victims and so on. But you have very little funding for research in terms of vaccine development, in terms of treatment, even in terms of diagnostic. For example, I doubt much if there is any center in the whole of northeastern Nigeria in which where you can isolate the Lassa fever virus. So you need to send sample to Abuja, to this Nigerian Center for Disease Control, or to Irua in Edo State for you to diagnose it. And the time lag, anything can happen in between that time period. So if you look at it, these are all areas in which we are found lagging behind. And during the COVID-19 global lockdown, you see that a lot of developing countries, have had their own share of suffering, because this tells us that we need to actually develop our own capacity in terms of diagnostic, in terms of vaccines, in terms of pharmaceuticals, and so on and so forth, for us to keep with the global pace of in terms of research and development. So these are some of the problems or the challenges that we are facing, particularly in this part of the world.
Yeah, I think that is really something that need to be addressed, and I hope the, the the people concerned, especially with the University Commission and health sector, the government policy makers, will be able to kind of act judiciously on this matter. So to retract on this issue again and ponder, we know, like from my own personal area of expertise, that is a total difference between people. The genetics environment can play, the genetics can play, a lot of things can hamper or like give you differences when it comes to understanding of how people respond to diseases, how people respond to vaccine, and how even people respond to treatment. Can you say, because of lack of research done on the local population in sub-Saharan Africa, is the reason in which why we still battle with this disease? Because we don't have a very high um, um, kind of like confidence with the treatment, because it's not done on people. The research is not done on a people. I don't know whether it kind of applies to infectious disease as well, because the statistics is still staggering when it comes to death. Despite that, we still see a lot of anti-malaria being imported, a lot of treatment being holistic, like our all medics are kind of on hand trying to solve this problem. Can we say that research done not on our population is the one leading to us not being able to be able to save lives more?
Okay, yes, I totally agree with you. It applies also to infectious disease, as you have said. You know, if you look at one of the papers that we publish in terms of neuroscience research, if you look at the output in the whole of sub-Saharan Africa, it's quite negligible compared to what you have in the global north, and then even in part of Southeast Asia. Uh, and we are also part of the global family. So we need to step in and develop our own capacity in terms of research uh, to develop, because nobody will come and do it for us. That's the truth of the matter. Because different parts of the world have different challenges in terms of their health needs, in terms of also other sectors of the economy. So
Exactly.
we need to develop our own, prioritize it, fund it, and then the private sector must also come in if we need to develop that capacity in terms of research. And then you need to catch them young. That's the word I want to use, because research is a career. So you need to actually catch people at a very, very early stage in their career, so that they develop interest and research, and then they grow in it, and then you mentor them. They also in turn mentor the younger ones that are coming up. So that's it.
Yeah, I think it's something that really need a lot of strategy and a lot of think tanks to kind of have a modality, and we hope to see some changes. Shifting the gear, Prof. I know you've been as the medical chief, the CMD. You've had a lot of health challenges, and you have mentioned the some little kind of epidemics you have experienced when it comes to the Lassa fever and also the meningitis. But of particular interest that Yobe have been known now is the issue of the chronic kidney disease, other known as the CKD in Joshua. So how can you describe the what is really happening there? Like for the
Okay.
people not living in Yobe, what is happening with the CKD in Joshua?
Okay. You know that recently we've done the data collection phase of it, courtesy of BioRTC and the Yobe State government, particularly in two local government, Bade and Damaturu. Yobe State, in the last two decades or so, have had it's one of the states in the country with the highest burden of chronic kidney failure, and we observed that particularly people come from particular region of the state, especially in the northern part of the state. We have high prevalence in communities that are along the fringes of the river Yobe. And similar things have been reported in the neighboring Jigawa state, particularly along the Hadejia Jamari River basin. That river continues at the River Yobe, from where the state derived its name, and it's one of the major tributaries of the Lake Chad. Same thing in Borno State. We've also had similar, anecdotally, there are a high prevalence of chronic kidney failure. And that's the reason why myself and the director of BioRTC, Prof. Mahmoud Bukarmaina, in about 3 years or so, we sat down and decided that we need to do something about it. And that was how the Yobe State government came in, thanks to our governor, Honorable Memala Bonisi ON, for all the support, as well as his team, the Minister of Health, through the Honorable Commissioner for Health, the Secretary to the State government, and all the top shots as far as the state government is concerned. They supported me, and especially His Royal Highness the emirs, their Royal Highnesses the emirs of Bade and Damaturu. They also gave us full support, especially with the community. So because of that, through BioRTC, through the director, Prof. Mahmoud Bukarmaina, we were able to connect with colleagues in the United Kingdom, particularly at the UCL, University College London, the London School of Hygiene and Tropical Medicine. We found out Prof. Ben Kaplan and then Prof. Neil Pierce, who have been working on this, especially on an entity called chronic kidney disease of unknown cause, which is now, is of growing interest, particularly in most parts of the world in which you see high prevalence of chronic kidney failure, particularly among agricultural communities. Ben and Neil have done some work in Central America, especially in Nicaragua and in El Salvador, as well as in Southeast Asia, especially in Sri Lanka, and also in some parts of East Africa. So it was based on that we sat down with them, we presented our own perspective. Then we had a preliminary work on that, in which we look at all the dialysis center, in Yobe State as well as in the neighboring states of Jigawa and Borno State. And then we found out that among people who are accessing renal replacement therapy at the dialysis centers in these states, we identified that majority of them come from particular area. And then we identified the hotspots, particularly in the Jakusko and by the local government areas. Based on that preliminary data, and then we designed a population-based work, which we conducted, last month, in the month of February. We use a population-based. We designed a cross-sectional study in which we look at the local government with the highest burden, that is like Bede local government, which is one of the hotspots, and then we compared it with an apparently low risk local government like Damaturu. So we've taken samples from the environment, like soil, from farms. We've taken water samples from the river. We look at the basement also from the river beds. We've taken samples from groundwater, looking at shallow and deep boreholes. We've taken samples from the food chain, the vegetable, fruits, the fish, and what have you in those communities. And then we also interviewed households in which randomly households were selected, and then adults in those households were also selected using random sampling methods, which blood samples, urine samples were taken. Also, some anthropometric parameters were recorded or measured, such as blood pressure, height, weight, and stuff like that. So for now, samples have been collected. We are at the analysis stage at the moment, and then hopefully in a couple of months or so, we'll be able to come up with a preliminary data on that, and then that can make us to chart for the next phase of the research, because we need to, if we are able to identify a possible risk factor, we need to also characterize the pattern of disease and so on. So we move to the next stage. So, and let me point out one thing at the moment, that this is one of the research that, to the best of my knowledge, that is sponsored by a state government in this part of the
Yeah.
world, in which a huge amount of money was spent by the Yobe state government, and it was a multidisciplinary team. If you look at the composition of the team, you have people from the nephrologists, you have physicians, you have ecotoxicologists, you have geologists, you have
Yeah.
GIS experts, population commission, you have public health specialists, nurses, community mobilizers, and what have you. So you name it, it cuts across all the disciplines that are necessary for such a research, and this is a good thing. And then it is also, you have collaborators from both the national, here at the country level, in which we have institutions like the ABU, Bayero University, University of Maiduguri, Yobe State University, and then people from the BioRTC, United Kingdom, and so on. So it was a multi-center and then collaboration both with national and international outlook. And that's a very, very good and standard research. And then a rigorous training was done. And at the research also, a lot of rigor has been applied to eliminate bias, to make sure that these things are not just occurring by chance, but that they are really there. So I cannot preempt anything at the moment.
Yeah.
We have to,
Exactly. Yeah. Thank you.
fingers, cross our
Thank
fingers
you.
and wait for the outcome.
Yeah. Thank
Yes.
you, Pro, for the
Yeah.
kind of providing a very, very huge holistic kind of like
Yes.
approach in which your best state is
Thank you.
taken away to research, and taking particularly on that, we have to retract some steps and really applaud and appreciate the efforts emerging from Yobe State. And I think this issue is supposed to be publicized at the Nigerian level, because this is something that is happening at a novel level in Nigeria. We've never seen a situation where that is the kind of coming together of how it's supposed to be. You have the preclinical scientists, you have the clinical scientists, and you
Yeah.
have all those multidisciplinary approaches like experts coming together to solve a single problem that is affecting the people sponsored by the state. It shows we have the potential. It's just like we just need proper policy. And I think other states, like for example, you just rightly mentioned on the fringes of the river Yobe, where you have some Jigawa and Borno state that have similar figures when it comes to the CKD. But Yobe seems to be the only one taking a kind of bold initiative and kind of to be
Mm,
with solving the problem. And this is something that is commendable. And we hope the Borno state and the Jigawa and other states are also listening and they're able to kind of engage, because we have lots of experts that they just wanted to be engaged in solving our local problems. Our problems can only be solved by us.
that's right.
Yes. So, and when you look further into the activities, like in the past few years, sponsored by the Yobe State government, when it comes to establishment of a research center, it's something that's gonna take time, but we have already started feeling the impact. I've seen the paper, some of the things. I think you have a paper on kidney that is on the archive about some of the findings you've just discussed, and it's really, really remarkable seeing that it's from the the resources, low resources we are having, and you're having these figures coming out. And I think um, it's kind of like really, really promising. So, for the sake of our known scientific audience, we have this have been a lot of scientific words. So, and I know how people think when they just, it's like someone that is hungry, and when you tell him something, what he wants is like, what is the solution? So, can you, what is I know that a lot of samples, probably more than 2,000 samples, which is really, really huge, have
Yeah.
been collected collectively in the course of this armada, I will call it, involving this group of people. So, what is the next step? For example, if a layman is asking, what is the next step as far as this CKD is concerned and Yobe State is concerned?
As you have rightly pointed out, uh, uh, about 2,000 human samples have been collected, blood and urine samples, which are, already laboratory analysis have commenced. We are waiting for the outcome. And at the same time, we've collected over 500 environmental samples on those samples that I had earlier, alluded to, such as soil samples from the farms where farming activities have been taking place. And it may interest you to know that even the farms have been categorized according to the years of cultivation. Farms that have been under cultivation for more than 20 years, less than that, or less than 10 years, and so on. Because all these things, in the long run, you need them in the final interpretation of the results in terms of duration, that in case you identify some environmental toxins, you need to look correlated along that line. We're also taking samples from the river beds, we've taken samples from the river, from the underground water, we've taken samples from vegetables that are commonly grown in those communities, looking at other things in the food chain, stored food products or crops, and so on and so forth. So all these samples have been taken, and then at the moment they are undergoing analysis. As you usually know, as far as research is concerned, you don't jump to conclusion. You need to wait for
Yeah.
the outcome of the analysis. And as I told you, it's a multidisciplinary team. When the results are ready, you also need medical statisticians who are going to analyze those things before you interpret them, and then you now draw conclusion based on the findings. So we need to
Mm,
wait for that. But taking you back down memory lane, the
yeah.
Yobe State government has also done some, brilliant work as far as the kidney is concerned, or let me say interventions. You see, the state government has been rendering free hemodialysis services for citizens of the state at the Yobe State University Teaching Hospital for the past 7 years, for the past 8 years rather, since 2017. When we started this, the state government was paying a standing payment, monthly payment of 5 million naira. But because of the realities of the day, galloping inflammation, galloping inflation, and cost of medical consumables and so on. This standing payment has been reviewed almost over 2 times. Now the state government is paying about 30 million naira monthly for pre-dialysis services. And if you sum up everything, you come up with like 360 million naira, on an annual basis. And that's very, very commendable. It's highly commendable. Looking at the, a state that is almost entirely dependent on the national or the federation allocation, the monthly federation allocation, but is committing so much resources to the health and well-being of its citizens. Also, the state government is now sponsoring this research as part of an effort in order to find the remote and the immediate cause of this highly prevalent chronic kidney failure in order to prevent its citizens. And then at the same time, about 4 years ago, or so, about 4 or 5 years ago, the state government also sent a high-powered delegation to the nephrology and urology and nephrology center in Mansoura, in the Arab Republic of Egypt, which is a
Yeah, I think we lost our speaker. A little bit of network glitch. I
to
think to
come
just yeah.
kidney transplant in the whole of Africa and the Middle East. The first was done in 1974 by Professor Mohammed Ahmed Gunem, who is a renowned world expert in the areas urologist and particularly a pioneer worker in terms of renal transplant in Middle East and Africa. And we have people coming from various parts of the
Yeah,
world to train there,
exactly.
particularly even from Japan, Canada, United States, United Kingdom. They go there for hands-on training. So Yobe State, we've almost signed an MOU with them. Unfortunately, the COVID-19 came in between, and we couldn't continue with that one. But still, I want to renew that MOU so that our medical specialists could be sent there to be trained on renal transplant. So that if you train your local experts and you bring in such services, back home here, you'll be able to render such services for people who have end-stage kidney disease, so that they can have kidney transplant at an affordable cost. Because at the moment, even here in Nigeria, you spend over 20 million naira for a renal transplant.
Exactly.
Not to talk of
And
the cost of drugs
yeah,
that you need, the immunosuppressant drugs that somebody has to take for a long period of time, and what have you, and so on. So it is a very expensive disease, and that's why the state government is doing all its good to see that it helps people who are suffering from that one. Then now we are coming to the preventive aspect. This is part of the research that we are doing now. And even in
yeah,
the course of the research, people who are found to have some degree of renal impairment will also be supported so that they can access care. We're not going to leave them like that. Based on
exactly.
the findings, even during the field work that we've done, we found people who with unacceptably very high blood pressure and then kidney functions. And those people have already been linked to treatment centers. And we are still going back once the outcome of the result is ready. We're going to going back to the community to see people who have some degree of kidney impairment, so that we can bring them so that they can access renal care or treatment at the same time. So it's a multifaceted approach to this
Yeah,
problem. We
yeah,
are looking both at those people who are already been affected, and then we are looking at people who are yet to be affected, and then people who are at the early stage of kidney impairment. So we are going to look at this from this multi-pronged approach. They are all going to be helped in one way or the other. So, and as I have said, one thing with research is that after the findings, we need to also make the findings of this work known to the state government, to the
yeah,
community leaders, as well as to the wider community. And then also you have to also recommend some proper solutions to this thing based on
exactly.
the identification of possible risk factors. So at the risk of preempting what we're going to find, but these are the things, the timeline, or in terms of the protocol of the work that we are going to conduct, or we've already commenced.
Yeah, because I know this is really kind of an emotional something when it comes to people affected. A lot of
Yes.
families have lost their loved ones, and people are just at the edge of their seats, kind of trying to wait, kind of just hoping to hear something that will be
Mm.
done. But like as you said, diseases like especially when it reaches the level of the CKD, that is already the advanced stage. And I would say in the northern states of Nigeria, like Yobe State is among the best performing state when it comes to healthcare. This is, I know the statistics can be staggering, like, but when it comes to my experience, I trust Yobe State more than a lot of states in there. And this is something that the government is doing, and we hope to see other government emulate and also take the framework and put it into practice, because the most important thing is like serving the people and saving lives. That is what government should look like. And yeah, so for those people kind of trying to ask a lot of questions on social media about the what is will be the outcome. The outcome can be in any form. It can be simple policy. It might be what people are doing wrong,
Yeah,
and you
that's
have with
right.
the government in, like
Yeah,
the
that's right.
policy can be implemented. It can be like
Yes.
prevention. It can be like holistic approach to something. So we just hope that the result will be out soon, and we will be have a lasting solution to prevent this. Because um, also because like if you look into the some of the diseases that have been eradicated in Europe, even malaria for example, it wasn't eradicated by medication, it was eradicated by policy, by cutting the chain, the breeding chain of mosquitoes, and you just eradicate them from where people are
Yeah,
living. Just common sanitation will kind of get rid of that.
that's right.
And it's something that we have a total disjoint, because there is a disjoint between the preclinical and the clinical. So you have lack of, especially in Nigeria, those policies, little policies are not being put in place. And will lead to my next question to you, Prof. You are wearing two caps, and this is something, you as a researcher, we don't see it common in Nigeria. It's common here in Europe and in where the things in the global north. You are a researcher and you're also a clinician, and you have a role as a PI in BioRTC, which is a Biomedical Research and Training Center. It means it's usually kind of most of the work will be focusing on the preclinical studies, and that is also aspect of the clinical studies. So how can you explain, like, and what call will you do? How do you see these areas complementing each other? That is the first question. And what call will you do to other states in order to kind of like bring these two fields together? And how do you see them like moving the healthcare system in Nigeria forward?
All right. Thank you very much, Dr. Zaid, for that beautiful question. As you have said, one of the best things that happened to Yobe State is the establishment of BioRTC at the Yobe State University. And that's a very good link between basic science and clinical science research. And there is what we call the 3B or the BBB. That's the, you need to link the bench with the bedside as well as the bush also.
Hmm.
When we say the bench, it's the basic, you know, basic science research that we do in the laboratory. And then the bedside is the clinical aspect of the research. You need to link the two. And then when we say the bush, is the looking at the environment, the ecology, looking at vectors, for example, when you talk about malaria and most of these vector-borne diseases. So you need to link the two, or the bush could also be the community, because apart from the hospital base, like what we did in the kidney research, you need to also go out to the community to see what is happening at the community level that is bringing people to the hospital. These are all
Hmm.
things that you need to link them up together for you to have a robust research in healthcare delivery. And thank God we have the BioRTC Center. They are doing a lot of molecular work at the moment. DNA extractions and what have you is taking place. We have the confocal microscope at the BioRTC Center in Damaturu, which is the only one of its kind in the whole of the West African sub-region. And then you have also linkage with a lot of one of the world-class research centers in the world, like University of Sussex Neuroscience Research Center, the West African Center for Cell Biology and Infectious Pathogens, in Accra, University of Accra in Ghana, the Louis Pasteur Research Institute in Dakar in Senegal, and all these things. There are some collaborations going on at the moment at various levels. Uh, so if you look at it, we're doing a lot of work. If you look at some of the work we've done in malaria, BioRTC has invented a very portable, microscope in which you don't need much power. With little training, you'll be able to diagnose malaria, even at the community level. The work is now being at the dissemination level. Most likely, they are using their 3D printer to produce that portable, locally made microscope that can be used in a resource limited setting to diagnose malaria. Also, you have to keep pace. I mean, with technology. Artificial intelligence has come to stay, whether we like it or not. And then the use of AI in medical diagnostic. BioRTC has been, for the past 2 years, I've done some training in terms of AI. I mean, to help both data scientists as well as clinicians in enhancing diagnosis and so on and so forth. We also were looking at the issue of gene deletion in the RDT kits that are used for rapid diagnosis of malaria, whether we have a lot of false negative out there in the field. This work is also going on. We are also trying to look at drug resistance in malaria, because we have seasonal malaria here in Yobe State, and you have people who will be telling you they've taken several anti-malarial drugs, but they are still not getting better. So why is this thing happening? Is the drug not good enough, or is there something wrong with the drug, or with the pathogen in the body? So BioRTC is doing a lot of work towards that level, to look at drug resistance in malaria and so on. And then this work is being done with collaboration with experts in the field. Like from the Pasteur Institute in Dakar, we have somebody who came last year, and we are trying to see how we can work together to answer some of these research questions. So
Mm.
there are a lot of linkages going on there. So as you have rightly said, Yobe State is setting the pace, and this is what we should be doing, like that is what is obtainable in the developed parts of the world, in which clinical research must be linked with basic science research, as well as community-based or population-based research. All these three must be working hand in hand for you to answer some of the challenging research questions or health challenges that we have in the environment.
Yeah, exactly. Yeah, I think, and we definitely need a lot of awareness on science communication for that particular point. You said
Yeah.
the linkage between the basic science and the clinical science, because I remember
Yeah.
like some years ago I would be having like heated argument with medics about the importance of research, and people don't see it to be important. People complain that okay, we need food, people are hungry, we have more pressing issues that we don't need research for. But in the real sense, like any country that is kind of ready to progress must embrace research. And if we can see like countries like the UAE and Saudi Arabia, how they are heavily investing in research, even China, no matter how big magnanimous China is, they still invest in a lot of bringing think tanks from the Western world, Nobel Prize winners, just because they want their own ideas on how they should be shaping things. So I think, and we have them abundantly. We just need to harmonize the system. So, Professor, and I just wanted to
That's
kind of
right.
like, what advice will you have for the young medical professionals now that imagine you being a medic and a researcher? Like, what advice will you have for the young medical professionals? Some that just finished medical school, some that kind of finished their fellowships now. What advice will you have for them, as far as the
Well, my
healthcare is
advice
concerned?
is very simple. That for you to improve on your career, that's why even in the residency training program, research has been embedded as part of it, because you need to write your dissertation, pick a topic
Mm,
for you to qualify as a consultant. And this is really done because for you to help you not only in your clinical practice, but also in answering some of the things that you'll be coming across as a practitioner. There are a lot of things that you see day to day, but you need to ask yourself the question: why is this happening at this particular time, or from this particular community, or in these particular individuals? And when you answer such basic questions, for you to answer them, you need a robust research. And then with centers like the BioRTC, I will advise a lot of my younger colleagues to also access the resources that are there. There are a lot of mentoring and so on that is going on there, and then if we collaborate, we'll be able to answer some of these questions. Looking at our colleagues in the developed part of the world, if you look at them, like the ones that we are working with, for example, in the United Kingdom, they are clinicians. They do their clinical work. At the same time, they create time. They apply for grants. They go and work in other parts of the world to answer some of these research questions, and that's how you'll be able to answer most of the challenges in your community. And then if you look at most of the even the universities, one of the fundamental functions of a university, apart from learning,
Hmm.
is research to answer
Yes,
most of the
exactly.
questions in the community. So I think for us to answer to function properly as tertiary healthcare institutions or universities or affiliates of tertiary institutions, we need to develop deep interest in research, not only in science, but sometimes even in the social sciences. Because
Exactly.
I remember you were mentioning about the perception of people or their
Hmm.
attitude towards certain things. So for you to deeply understand the perception of individuals as well as community in terms of certain healthcare challenges, you need to carry out social science research. Why is it that our people don't want to take their children for vaccinations? Why are we not accessing certain health intervention? What's the perspective? Because most of this, even the common diseases that we have, like malaria, if a child developed malaria, the under five child became unconscious, and the child is convulsing, people will say that that child is either possessed by demons or some
Yes.
witches that have bewitched that child or something of that nature. These are all perspective of the people.
Yeah.
Even the kidney failure and other diseases, once the kidney fails, it can make people, when they become uremic, to be talking irrationally, and people can attribute that to a lot of things. Maybe yes, they can blame on it on demons, on witches, and so on and so forth. So we need to do some even social science research to understand the perspective, and it is when you know that you'll be able to educate the people, educate the community, and then change their attitude to even their health-seeking behavior. Why is it that our people sit at home until when they become helpless or when they are in trouble before they come to the hospital? Why don't they access
Yeah.
healthcare? What is the attitude of the people towards preventive healthcare or promotional healthcare? How many people do
Exactly.
exercise, healthy eating, and so on and so forth?
Healthy eating.
So all
Exactly.
these things could only be answered through
Yeah.
a very, very robust research. And then the findings in the research are not only for publication and promotion in the university, but when
Yeah.
you need to disseminate it to the people. You need to also look at link your findings with policymakers to convince them that this is happening. This is the reason why these things are happening, and then if you implement ABC, you'll be able to improve on such
Exactly.
things and so on. So it's an
Yeah.
all-encompassing thing that everybody's hands must be on deck for us to
Yeah.
move our state as well as our country forward in terms of science or healthcare research. Thank you.
Yeah. And I think, like you said, the most difficult thing, I think, as far as like the terrain of Nigeria is concerned, is getting the policymakers to listen. And you in
Yeah,
Yobe State have managed, Prof, you've managed to kind of get the ears of the policymakers. And I think, um, probably in the near future, Yobe State will be maybe the point of reference to a lot of states when it comes to how to tackle local
inshallah.
issues when it comes to diseases. And I just see, probably we just identify a new area of social science that will be incorporated into your other research, Prof. Maybe, maybe like, because it's really important how people think about something. Perception is
And that's
what
right.
they believe. The belief is kind of like really, really powerful. We're coming to the last segment of the discussion today, Prof, and we have 10 minutes remaining on the clock. So let me go to the chat to see if we can have some one or two questions and for you to answer. So we have a lot of goodwill messages from the from the listeners. Yeah, okay. Yes, these are all praises. Waru Goni is a cerebral scholar and one of the great medics of our time. That is no question about it. You are welcome, Professor. So one is asking what efforts are made to address kidney failure issues in Yobe. I think half of our own talk was about that. I think
Yeah,
we
yeah.
have addressed
I think
that.
we have answered those
We
questions.
have
Yeah.
answered that, yeah. So this one is given an opinion. My perception in respect to Gashua body in general with regard to CKD issue is that the use of generic or low quality seed could only contribute to kidney crisis. Thank you, Prof, for the good presentation. Well, this is an opinion, and that is what the research is for. So we wait for the. We don't want to jump into conclusions, and we wait for the
Mm,
outcome of
yeah.
the. Yes. So this one, my second question is why the federal government is not intervening the fight is only left with the Yobe state while the problem is horrible and overwhelming. So, yeah,
Well,
well,
well, we cannot say the federal government is not intervening, but sometimes uh, Yobe State has taken a bold step. But as far as the federal government is concerned, you need to make them aware. You need to write. They also provide some funds through the PTDF. Is it the TED fund rather now? The TED fund, research funds, and then we have the National Institute of Medical Research, NAIMA, and so on and so forth. But why the state government is taking the bull by the horn is that the state government is more closer to the people than the community. And again, I think for you to say the federal government is not doing anything, you must
hmm,
have approached them first. But
exactly.
I think maybe we didn't do that enough. I'm not sure. But
Mm,
for you to, we cannot just say that they have not done anything. I think
yeah,
they also have a role to play sometimes. If you approach them properly. But
yeah,
the federal is looking at the whole country, and they have a lot of things on their hands. So, but the state government is more closer to the people. That's why the Yobe state government is setting the face. But before this work came into being, about 7, 8 years ago, there was a committee that was set up by the state government to look into this problem of prevalent kidney failure. I think the Federal Ministry of Health was also there, the Nigerian Center for Disease Control, and other international partners like the World Health Organization and so forth. But for one thing or the reason, that thing could not, take place. And then we thank God that now the state government is taking the bull by the horn. Yeah, thank you.
yeah, exactly. And just to add that to the simple kind of way of perceiving things, like everything works in stages, and it's just like I was approached by a colleague probably some days ago telling me that they want us to do subscription for something. And I was telling them we cannot just approach the organization and tell them we need subscription for this. We have to show the potential of what we are doing first.
That's
So
right.
yeah, we have to take the initiative, show that okay, this is worth investing in, and you
Yes,
have the
yes,
team and you have the proper management. But
yes,
oftentimes we just kind of just relax and we don't do any initiative and we just put the blame on okay, someone is not doing someone, which is I think our youth should have a different mindset when it comes to approaching problem.
yes.
Yeah, so this is from Halim Alkali saying, what are the symptoms? And probably I think she's talking about the CKD symptoms of CKD and how to prevent it, which is kind of really relevant because prevention is always better than cure.
Well, I think well, symptoms of the chronic kidney failure is, I don't think this is the right forum for us to discuss that. We're talking
Mm,
about research. We
exactly.
usually don't like discussing symptoms because you may think that a lot of different diseases may present in a similar way. So
Mm,
until somebody comes to the hospital, he sees a specialist, and then he's evaluated before he knows that he has a common kidney failure. But one of the common symptoms are in chronic kidney disease, people will come with body swelling, generalized body swelling, facial swelling, high blood pressure, and then low hemoglobin or low blood levels. These are all common presentation that is been seen. But mind you, because somebody's body is not is swollen, that doesn't mean that that person is absolutely having chronic kidney failure. Other diseases, especially heart diseases, chronic liver disease, and
mm,
different types of diseases could present in a similar way. So
mm.
honestly, I wouldn't like to go into saying that in this program these are the
Yeah.
symptoms. of this thing. But
Exactly.
I like the second part of the question, prevention. How do you prevent?
Yes.
The common cause of chronic kidney failure worldwide, hypertension, diabetics, and then chronic infection of the kidney, that is called chronic glomerulonephritis. So people who are above 40 years and so on, or who are hypertensive, should go for regular checkup. If you know you have hypertension, somebody should take his blood uh, antihypertensive drug regularly. Same thing with diabetics. People should adhere strictly to their doctor's advice. Also, you exercise a lot, weight reduction, the healthy eating. All these stuff that are done in terms of health promotion. Then exercise doesn't mean somebody must play sports or become a footballer or whatever, but bricks walking and so on. These are all forms of exercises that could be done by most individuals. So these are all ways of preventing it. And of course, this one that we're talking about in Yobe State is a different ball game altogether. We are
Mm,
looking at it under an entity called CKDU, that is chronic kidney disease of unknown cause. And that's why we are trying to unravel the cause. That unknown is what we are trying to make it known now through
mm,
this elaborate population-based research. So by and large, it's not always good to just say that these are the symptoms or signs of certain
yeah.
diseases in a fora like this. But it's always good that we know that different diseases, when somebody is sick, as part of the health seeking behavior, he should try and see a doctor as soon as possible.
Mm,
I think that's the advice.
exactly. And I think we should encourage people to go to the hospital more often, not because only when everything is have deteriorated, you cannot walk, like a
Mm,
lot of things are bad. You should go for checkup. And
mm,
all the things you have mentioned, Prof, it just has to do with lifestyle modification, hypertension, diabetes. Most of the things are lifestyle. So
that's right. That's
embracing
right.
a healthy lifestyle will kind of like go a long way if like the
Yeah,
familial
prevent most
cases
of
are
these
not
things.
that. Yeah, so we have a had we
Then
just
in
have a
this
lot
part
of
of the world also, heat stress sometimes, you
heat
have,
stress.
especially in the months of April and May all the way to June, we have
Yeah,
the ambient temperature could be as high as 45 sometimes.
it's
So we
very
advise
high.
people to take in a lot of water during those period of time, because kidney stone is also very, very common here in our environment. Because during
Exactly.
this, when the temperature is very high, people sweat a lot, the urine become concentrated and it can precipitate some crystals within the urinary tract, which can solidify to form stones. And it's very,
Yeah.
very common in this part of our world. So during the heat season, people should reduce exposure to heat as well as taking a lot of fluid, particularly water and so on, as part of the general preventive measure.
I think there should be a lot of awareness creation, probably, Prof.
That's right.
Since you have link with the government, I think probably maybe we are in March now. We are approaching April, so there should be a
Mm.
sensitization, extension
We've
workers.
been
I don't know,
doing
like
some media health talk or health program on the local
hmm,
media in our
yeah,
local languages. But as
exactly.
I absolutely agree with you that that may not reach everybody in the nooks and crannies of the state. We need to
Yes,
engage the community also,
massive
especially
campaign.
through community mobilizers, community health workers, because we've learned a lot in the Gashua projects, because
Hmm.
the community has helped us a lot. And if we don't involve those community mobilizers and leaders, the community gatekeepers, there is no way we can change the attitude of our people or try to bring in a healthy lifestyle to our people.
Wow, that's really really interesting. We only
Mm.
have 2 minutes, and let me glance through. There's a lot of good well wishes. Usman, Mariam Shatima, they are all just good well wishers. We thank you for appreciating our speaker today and for joining, for being patient with us from the beginning up to the end of this segment. That is this one which you said, what a wonderful presentation, Prof. I just want to ask, why is it that there is a huge gap between universities and then our industries in terms of research? When you look at research in university, it does not have any industrial application. That is yeah. So, Prof, if you can do that in less than a
Yes,
minute, we will
that's right.
appreciate
I
that.
think, as I've said, R&D, if you look at most developed countries, pharmaceutical industries come to research institutes to research on basic, some of the drugs and then this is where basic science comes in. You start the research with guinea pigs in the laboratory, rats and what have you, before now you go to the next phase of when you apply it to humans and so on. Well, this is a very big question. It's $1 million question, which is very
Yeah.
difficult to answer. But one thing is that maybe the policymakers should be made aware that we need that, and then the private sector should also invest in most of our universities. Also, in the universities also, research should be made a priority.
Hmm.
And this could only be done through grant applications. When you apply for grants, some of these research institutions, or you access these grants, it is true that you will be able to make breakthroughs because research is highly capital intensive. It's beyond an
Yeah,
individual.
exactly.
So we need to do also a lot of creating awareness at different levels, including
Yeah.
policymakers, including the private sector, and so on. And then
And
people should
even
be
charity
encouraged,
organizations,
charity
because
organization, and so on.
yes,
Yes,
what we
so
kind of
that
really lack, you see,
and
in
some of them
Maiduguri.
are long term. You can apply
Yeah,
for a grant in which you need to carry on the work for some decades, sometimes, for
yeah,
example. So
yeah,
it's a million
yeah.
dollar question, which is very difficult
Yeah.
to answer.
So I have to
But
cut you short, Prof, because we already
yeah,
over a minute and 20 seconds over the designated 1 hour timeline for
all
this
right.
interesting discussion. I would like to thank you for finding your time in your busy schedule to join us live to discuss these interesting things happening in Yobe State, and especially about your career as a researcher and as a clinician. And we hope the voices you uttered today will kind of will echo into a lot of places in Nigeria, within the medical schools, within the universities, with regards to health sector, and even the policy makers will kind of share the insight you've shared with us today. And we hope to see positive things emerging from Nigeria at large, and even the whole of sub-Saharan Africa, when it comes to infectious disease, when it comes to prevention, when it comes to a lot of things. For the viewers back at home, I would like to thank you for being patient with us, and apologies for the delay in starting the podcast on the designated time of 4 p.m. West African time. We thank you for joining us and being patient with us. And on behalf of all the team that have worked hard behind the scenes to see this segment comes to you live, I myself, who kind of like been the face of this, say thank you and do have a wonderful evening. Goodbye.
Thank you very much, and Ramadan Mubarak to everybody. Assalamu alaikum.
Ramadan Mubarak. Alaikum